Hey everybody. First I want to say thank you to Neil and the whole Full Spectrum team for inviting me to address you all today. This is quite an honor and really exciting for me. You know, being queer and a leader in queer cannabis is not something that I take for granted. And it's truly an honor to be able to address you all today. So thank you again, Neil, and the whole Full Spectrum team. My name is Amber Center. I'm CEO of MAKR House. MAKR House is a cannabis manufacturer headquartered in Oakland. We manage a shared manufacturing facility for social equity operators, helping them create products and then facilitating getting those manufactured cannabis products to the retail market. So the incubator that I run and manage is called Equity Works Incubator. It's the first of its kind in the country. It's funded largely in part by social equity dollars that come from the social equity program. So really awesome project, something that's unique and really hope that this model continues across the country and that other entrepreneurs help other entrepreneurs succeed in cannabis. I'm also the co-founder, executive director, and chair of the board of Supernova Women. So Supernova Women is a 501c3 nonprofit. We were founded in 2015 by a group of Black and brown women working to create opportunities for Black and brown people in cannabis. So a bit about me, my background, and how I got here. I'm a queer Black woman. I do not identify as non-binary, but definitely more masculine of center. So I guess kind of like a duality, of two things, masculine and feminine, which I've ridden that line my entire life, ever since I was out of the womb. And I really like to just feel comfortable in my skin and be who I want to be, which is beautiful and handsome at the same time. So I'm also a patient, medical cannabis patient, as most of us are. I use cannabis as medicine, and I'm a Coast Guard veteran of the United States Coast Guard. So the opening keynote earlier yesterday is the husband of Dennis Perone. He was around and helped create Proposition 215, which was 25 years ago. I was just 16 back then. But I was definitely very intrigued on what was happening here in California, and always wanted to move to California one day. So pretty awesome that I'm here and have the honor of really being in this role that I'm in now. I moved to California in February of 2014, so I'm actually coming up on my 8-year anniversary, which is awesome. Those years definitely flew by quite quickly. And I moved here as a medical patient. I mentioned before I'm a patient. I was diagnosed with lupus in October of 2013. I was living in Chicago at the time, and really needed to move to a place that was warmer, as well as a place where I could access a number of medical cannabis products without fear of prosecution. So I moved here in 2014, and I started a regiment of full extract cannabis oil, along with a number of other products, topicals, tinctures, of course, smoking. Like, it's kind of funny when people ask me, like, what's your favorite method of consumption? It's all of the above. There's my Puffco right there. Dabber, capsules, joints, tinctures, edibles, topicals, salt baths, you name it, I'm about it. So, California had all of those things, whereas the time I was in Chicago, it wasn't even legal yet. Chicago didn't even have a medical program at that time, or Illinois did not have a medical program, so I moved here to seek medical cannabis, and I ended up using cannabis to help me really get back on track with my health. It took about 6 months, and I always knew cannabis helped me. Obviously, I've been using cannabis since I was 18 for a really long time. Noticed right away how it helped me with symptoms of like anxiety and nausea and body aches and all these things I was dealing with, but I didn't have a diagnosis back at that time. So I was so grateful to be able to move to California and have all of these different products to help deal with the symptoms that I was dealing with. When I moved here, I actually moved here to work for a really famous cannabis activist. His name is Mickey Martin. He was the CEO and owned a company called Compassion Edibles. And Compassion Edibles was one of the bigger edibles companies. They were one of the first that made branded products. Before they were known as Compassion, they were known as tainted edibles, which nowadays I don't think would go over very well. But back then, that was their name. And Mickey was an incredible patients access and patients rights advocate. I learned a lot from him. He passed away a few years ago, but he was really the person that brought me to California and showed me the opportunity that was available to me in cannabis in California. Mickey also introduced me to Debbie Goldsberry. Debbie Goldsberry is another kind of legend in cannabis, an OG for sure. She owned a dispensary along with Ed Rosenthal, and they hired me and brought me on as a partner and made me the chief operations officer of this dispensary in West Oakland. And this was prior to legalization. So dispensaries then were much different than they are now. They offered a number of different services that they don't do anymore. And our dispensary was very community focused, very much patients in the community first. So, we had things like a number of free services, which a lot of dispensaries had prior to legalization. Acupuncture, massage, yoga, sound healing, and then a very robust compassion program. So we had days where, patients could come in and get free cannabis. You get a free gram of weed every week. It was definitely a different time. And around 2015, the narrative started to change a bit because obviously legalization had happened in places like Colorado. California had attempted to legalize and failed. And everyone was really waiting for California to do something monumental and legalize, because they knew once California flipped, that would really set a trend for the rest of the country. And so the narrative was patient focused, obviously, for a very long time, since 1996. But there were people still going to jail for weed. And cannabis and legalization is very much a racial social justice issue. Like, we're locking up black and brown people disproportionately for small cannabis offenses, for cannabis offenses, for drug offenses, and it has to stop. It's still happening now, but it was much, much worse prior to legalization. And so, all of this is happening. People are still going to jail for weed, and cannabis is so normalized. And, there's people on TV smoking it. There's politicians saying they smoked it. There's all these people talking about, how they use cannabis. And we obviously needed to change the laws. So, around that same time that this narrative is really starting to pick up steam and actually affect change, my friends and I came together and started Supernova Women. So I met Nina Parks, who's one of the co-founders of Supernova Women, on Valentine's Day, funny enough, back in 2015. And we met at a party. It was a VIP party for a cannabis business conference. And we get to this conference. Nina and I are the only two black and brown women in the whole place. And, that was really kind of things that make you go, like, what the heck is going on here? Why are we the only black and brown women at this VIP party when we're talking about cannabis legalization, and this definitely includes our community? So Nina and I talked, we became friends, and we continued this conversation. A few months later, I met my other co-founder, Sion Sunshine Lencho. I met her at a women's focused cannabis event, maybe around May, June of 2015. And, I get to the event, and she and I started talking because we're the only black women at this event. This is a women's event, and there's only two black women there. And that was concerning to us as well. So Sunshine and I became friends, and then we started just kind of talking about this and hanging out and having these types of discussions. So I'm having these discussions with these two people separately, and I'm thinking, like, wow, I should really get them together, and we should all talk about this together just to see what comes of it. So I threw a party with my friend, another queer guy. His name is Anthony Martinez. He was living in San Francisco at the time, so we threw a party at his house. We called it Easy Sundays, and it's actually a quite queer party, obviously. And definitely, by the way, sidebar, make sure you follow Easy Sundays on Instagram, because we're going to be picking these parties up again, and they're a really great time. But so I invited Sunshine and Nina to this party. They both came. I introduced them to each other and told them that I had been having these conversations with each of them separately, and I really wanted us all to talk together. So we had a dinner the following week at Sunshine's house. And then we started this organization, this group called Supernova Women. And the premise behind the group and the idea was that we were just going to work as hard as we could to make sure that our communities were informed of what was happening in cannabis with the regulation and legalization of cannabis, and that we had a seat at the table. So the organization founded in October of 2015, and then as I mentioned, we started it really just to increase participation amongst Black and Brown communities in cannabis. And then right around that time, there's a lot of talk about regulating cannabis medically, as well as legalization again comes to the forefront. And we did not endorse Proposition 64, which is the legalization initiative that passed here in California, but we knew that it was inevitable. So we definitely did not endorse it because we knew it would be problematic for participation in the industry. But as I mentioned, we knew it was inevitable, so we just needed to prepare our communities for what was to come. So around May of 2016, we're having events. Supernova is having events, and we're actively advocating at City Hall for making sure that our communities can be and will be included in this regulated cannabis economy. And so out of that advocacy, there's actually a health and safety committee meeting where Desalie Brooks, former council member of the city of Oakland, comes up with the equity program, proposes it, and really champions the equity program. And so Supernova starts working really hard to make sure that this equity program works for the community and for the folks that are going to be participating in it, and making sure that that it's got all of the components that are needed in order to support Black and Brown entrepreneurs that are seeking cannabis licenses. So, we used to show up at City Hall, doing all kinds of things, obviously advocating, and we use a number of tactics to get people there and to stay there. I mean, they'd be really strategic in these meetings. When I say they, I mean the city and council and folks. They would put our agenda items at the very, very end. We'd be at city council till 1, 2 o'clock in the morning. It was nuts. And back then there was no Zoom. We would have to show up in person. So, we would do a number of things to keep people there. We'd bring dinner. We would bring big trays of chicken wings. We'd bring joints. We'd bring bags of weed so people could smoke outside, take a break before we'd have to go in and give testimony. And then we would also print talking points on half sheets of paper and make sure everybody had it. So not only people knew what Supernova was there voicing our concerns about and advocating for, but so that would help um, our colleagues craft their talking points as well. So around that time also, there were other advocacy groups that started to pop up. The Hood Incubator is one, which I'm sure a lot of you are familiar with, and if you're not, you should get familiar. Lanice Martin and Abele were the founders of the Hood Incubator, and they're both queer. So I'm sure you can see a theme here that queers really get things done. So, in all of that, social equity programs were adopted by the city of Oakland, and now they have become a national conversation. Once we got that done in Oakland, we worked in San Francisco. Sunshine and Nina worked really heavily over in San Francisco to get an ordinance passed there. And Sunshine actually got an award and was formally recognized for her work in crafting social equity programs in San Francisco. And then we worked at the state. So at that time, we were working with Senator Stephen Bradford's office. There's a gentleman by the name of Rashad Johnson who now works for Ease, but at the time was working in Senator Bradford's office, and we worked with him to get SB 1294 passed, which now funds all the local social equity programs throughout the state of California. And now, as you know it, equity programs are across the country, and not just here in the United States, but there's talks of equity programs around the world. The UK is definitely there's an effort there where folks are working to legalize cannabis and do it very social justice minded. They're much farther behind than we are here in the United States, I would say. They're a good 15 years behind where California is right now. So they have quite a ways to go. But the type of work that we do here in California, the work that we do here in the United States, definitely resonates around the rest of the world. So it's very important that we lead and do these things with intention because the world is watching. And equity. So, this term gets thrown around quite a bit, right? Like equity programs. What is equity? Equity and cannabis, at least as it pertains to cannabis, is righting the wrongs done by the war on drugs and including communities most harmed by the war on drugs. But are these programs actually doing that? Well, as the programs have been written and their intention from the cities is to create opportunities for underserved communities, over-policed communities that have been most harmed by the war on drugs, to participate in the regulated legal cannabis industry. Now, in my opinion, that is a very narrow focus of what equity is, right? That is this much to a problem that is this big, right? Equity programs need to address the harms done by the war on drugs, period. Not just a very narrow, risky opportunity in a highly regulated, high barrier of entry industry. You see what I'm saying? Like, we have to really think about how the war on drugs affected our communities. It wasn't just it wasn't just weed. The war on drugs took fathers, mothers, children, homes, jobs, opportunities, lives. It took so many things. How does offering a cannabis license fix that? It doesn't. Not even close. So it's really important that we understand that we know that we acknowledge that, and we work towards impacting what was taken. Our job is really to make sure that we continue to make these programs impactful for our communities. Does it matter that it shouldn't matter that someone doesn't want to open a cannabis business. Why is this so focused on cannabis entrepreneurship and ownership? It should be offered to anyone. Anyone that was harmed by the war on drugs. You should be able to open a restaurant if you want to. You should be able to open a barbershop if you want to. You should be able to get a housing grant if you lost your house due to some sort of seizure that was connected to cannabis or drugs. We really need to think quite more expansively on what the harms the war on drugs did to our communities and what repair and justice actually looks like. And also equity programs, right? So now that we're talking about how we should look at them, how they should be really examined, also know that equity programs are not one size fits all. What works in Oakland won't necessarily work in Charlotte, North Carolina. The areas are different. They were impacted differently. Folks in those communities suffered differently. The programs should look different for each municipality. So Humboldt has a social equity program. It looks nothing like Oakland's social equity program. And these programs really need to be tailored to the communities themselves, which is why it's very important for the community to have a seat at the table when these programs are being formed, when they're being discussed. They need to be led by those marginalized communities that were most harmed during the war on drugs. And lastly, of course, we can't forget about the patients. Patients currently in the regulated market can't afford the cannabis. It's just incredibly expensive. Even when I go to the dispensary, I make cannabis products. I'm like, geez, 35% tax? This is insane. I can't pay that. Who can pay that? I go buy 2 Ace, $50 a piece, $100. Cashier rings me up, bartender rings me up. It's $135, $140. Why? What is this? What is going on? This is nuts. And if patients can't afford this, well, what did we do this for? What was this about? Access to affordable cannabis is equity. It's an equity issue. Access is an issue of equity. Medical cannabis patients still need support. The compassionate piece should have never gone away. And we have to make sure that cannabis is affordable to everyone because access is an issue of equity. So, at the end of the day, addressing you all, my fellow queers. Queers lead movements. Queers get things done. We look at what happened with the Black Lives Matter movement. That was led by queer Black women. Queer Black women were the co-founders of the Black Lives Matter movement. Queers have a voice. Queers have a very loud and powerful voice. Queers can move mountains. So, I ask you all to be active. And if you are active, thank you. I ask you to stay active. I ask you to stay engaged. I ask you to push the boundaries. I ask you to continue to push our agendas forward. I ask you to hold our legislators accountable. I ask you to have grit. This is not easy. Most of us are patients. We're tired. I ask you to find your tribe. I ask you to support one another. And I ask you to lead with hope and lead with love. Thank you all.